Hello everyone. Today we have with us Mrs. Pratibha. She is a renowned business person with a 30 years experience in HR and a passionate perfumer. A woman who is full of life, dynamic, vibrant and our pink fighter. She is going to share her journey of how she underwent the treatment for breast cancer. So over to you, Pratibha.
Hi. So this last December, I thought I'd got, in fact in November, I thought I got hurt and I visited my gynecologist, Dr. Anjali, who put me on some medication thinking that it is an injury and, she gave me medication for it. But since it didn't go away, she handed me over to this extremely nice doctor, Dr. Mansi, who also then kind of put me under observation with some medication. But I was detected with an early stage of breast cancer. And as soon as I was detected, I think ma'am had operated me within 3 to 4 days, and my chemotherapy started. And it was initially it was difficult. It was very difficult because, to have something like that and to go through it. But then the doctors were so supportive. Dr. Pooja, who was doing the chemotherapy with me, she was so supportive, and the answers, the questions that I asked and multiple questions that they answered, and of course the faith that I had in both of them was what saved me, helped me sail through. And believe me, this is, I think, 15th day after my 16th chemotherapy cycle. And I am doing really good. In fact, in between all my chemotherapies, I've gone out, I've partied, I've gone for treks, and it was beautiful. And believe me, if it was not detected, if I did not go through that entire detection process, this would have gone so far that I can't even imagine, because it was detected, because there was so much of proactive. I was proactive, my doctors were proactive, that it was caught in an early stage and only the lump was removed, and there was no need for the entire breast to be removed. And it was not very easy, but it was a very otherwise handleable process, and it didn't hamper my lifestyle. It didn't hamper me at all. So all I will say is thank you to my doctors wholeheartedly, that I've had a good stint with, in spite of chemotherapy and the operations, and I'm cured today. I'm actually very, very grateful. Very, very grateful. Also, it was actually a very emotional time for my family, because my mother-in-law had also gone through it, and so it was very emotional for me to go through it as well, for my family. But in between, we went to the hills, we went out for dinners, and I kept myself actually very active and in a very, very positive state of mind. That helped me tremendously. There is no need for anybody to hamper your life or be on the bed just because you're going through therapy. You can be as active as you like. You can push yourself, see how much your body can take. And there's no need to feel negative about the entire disease. It's just a disease. It can be treated. Whatever stage you're caught at, it is treatable. Your life is not going to go anywhere. The treatments are excellent. You can be very well taken care of. Just be positive. Go through with it. Have a good time. Don't feel negative about it. It doesn't help.
So since the very first time when I met her, she was the smiling lady telling me that, okay, this is the problem I have, but I have to travel, is it fine? And throughout the journey, she used to go around and I used to see her pics from trekking, and she has been smiling throughout. And this is what we actually want from our patients, that keep your spirits really high, have a positive mindset, because that really helps you go through this difficult journey. And also with a lot of family support and support from the medical fraternity as well. So thank you so much, Pratibha ji, and from the deepest of our hearts, we wish you all the best, and wish you should always keep smiling like this.
Today we are going to talk about a fairly novel technique used to treat breast cancer, that is breast oncoplasty. Breast oncoplasty basically is a group of surgeries which can be done as a part of breast cancer treatment. Oncoplasty is basically two words, onco and plasty, which combines the principles of cancer surgery to remove the tumor from the breast, but at the same time uses plastic surgery techniques to restore and remodel the shape of the breast after removal of the entire tumor. This helps many women who cannot be treated with conventional breast conservation surgery because of larger tumor size, or because of a difficult location of a tumor, or because of many other reasons, could be included in conservation surgery because of this technique. Breast oncoplasty largely consists of many surgical techniques which could be classified as level 1 oncoplasty or level 2 oncoplasty based on the extent of difficulty of performing that procedure, or it could be a volume displacement or volume replacement kind of surgeries in which only the breast tissue which is left behind could be reshaped and remodeled to make an aesthetic appearance of breast after breast cancer removal. Or there can be volume replacement oncoplasties in which tissues from other part of body like flaps are brought into the defect created after cancer removal. The advantages of this type of surgery is conservation, which obviously gives a aesthetic and cosmetic appearance after the breast cancer surgery, but at the same time it also provides a better emotional and mental state to the patient after receiving the breast cancer treatment. I would like to point out here that it is an age-old myth that once you are diagnosed with breast cancer, the entire breast has to be removed. So breast conservation surgery has been there for decades, and now with the new horizons achieved by breast oncoplastic surgeries, there are higher possibilities that even difficult larger tumors in smaller breasts could also be conserved. This procedure is very safe oncologically, that is from cancer perspective, and once diagnosed with breast cancer, you should always take an opinion regarding whether you are a suitable candidate for such kind of procedures. It does not involve any greater risk than any other breast surgery and is very oncologically safe. Our team in this hospital is fully equipped to perform such kind of procedures, and we have been regularly doing this for years. If you have any queries regarding breast oncoplastic procedures or breast cancer surgeries, you can contact us through the given website or numbers.